So this is the medicine task wherein you are the doctor in the aged care facility, and it is given in the role play card that the son or daughter has asked they want to talk to you. So you definitely know which patient's son or daughter they are. So in this case, although you haven't met them personally before, you are still aware whom you are talking to. So you can just confirm whether you are talking to the right person. And then it is more about finding out what concerns the son or daughter and then trying to address their concerns. So this card is mainly about a lot of reassurance and giving some practical advice on how they can take care of their parent while they are staying in the nursing home. Another new aspect that you would find in this particular card is if you see the last bullet point, it says carer advocate groups. And I'm sure you might not be aware of this because it is not very common in India or in Asia. So I'd highly recommend doing a Google search on this term, how they actually function and what kind of support they can provide. And as always, while you are watching this video, keep this role play card in front of you so that you can see how I'm elaborating on each point. So, good morning. Good morning, doctor. Am I right in thinking that you are Shivani, Miss Smith's daughter? Yeah, that's right. The nurse informed me that you wanted to discuss something with me. So please feel free to say what you would like to discuss. Yeah. I just actually wanted to know a bit more about the health check that you just did. Okay, sure. So I checked her vital signs, keeping her age and the other chronic issues that she's having. I think her vital signs are within the normal range. Also, I performed a thorough physical assessment, and nothing new came out of it. So, she is not having any new complaints, problems. She seems comfortable at the moment. That's a relief. Apart from this, do you have any specific concerns? Yeah, it's just been a week that she has moved into this aged care, and I'm just concerned about her well-being. Oh, that's absolutely normal to feel that way because probably this is for the first time she's staying away, yeah, from you, right? So, would you like to tell me more about exactly what is concerning you? Uh, Honestly, it's been 10 years now that I have been taking care of her. And I didn't realize when we decided to shift earlier that it would be so difficult to let her go and that someone else would be taking care now. So it's just been a bit difficult. Okay. So it seems that you are worried if she would be getting enough support and care here while she's staying away from you. That's absolutely normal. Now, let me reassure you how this care home functions, right? So, this is particularly for dementia patients, and therefore, all staffs are trained to deal with dementia patients. They are aware that these patients can be forgetful, they can feel agitated very fast, they have memory issues, so they might not recognize people. Okay, and sometimes they also become quite confronting in terms of when their demands are not met. And this is where you might think that the conflict would arise between your mother and the staff. But these staffs are trained to tackle all these situations with calm. Okay, so they won't kind of complain about your mother, and they will make sure that she remains comfortable during her stay here in the care home. I hope that is reassuring. Yeah, actually, it sounds better. I feel good to hear that she will be taken care of here. Yeah, so they are professionally trained, and the personal conflict would not arise, and they would make sure that every patient gets, enough support and their rights are protected while they stay. Okay, okay, that's nice. Is there anything else that you would like to ask? Is it possible, like, if I visit her, or maybe because I still want to be of some help to her. So is it possible? Yeah, absolutely. This being a care home, the rules are not that strict about visiting hours and all. So you can definitely come anytime and spend time with her. Okay. There are no restrictions as such. Now, what you can do to help her, is when you are visiting her, do some activities that would boost her brain power. In dementia, we need to make sure that the brain constantly remains active so that we can prevent further shrinkage of the brain and further deterioration of the condition. So it would be really helpful if you could read something interesting to her, or if you could play some board games, puzzles with her. So that would help her stay connected with you, and it will make her brain function and direct her energy in a positive way. Okay. Right. Another thing you could possibly do is taking her for a stroll in the garden. While this would help in terms of improving her blood circulation and mobility, and at this age, you would get an opportunity to chit chat with her about her day, and you can really find out how she is feeling about staying away from you, and if she has any concerns about the staff or about the facility, she can open up and discuss those problems with you, and then maybe you can collaborate with our staff to ensure that she gets everything that is required. And finally, nursing staffs will be taking care of her personal hygiene. It would be helpful if you could help her with her nails and hairs and skincare so that she will get that personal touch. You can make sure that she remains well hydrated and well managed. Do you think this is doable? Oh, yes, absolutely. I think I can be a part of her life in this way. And also, I live nearby. So I think it would be okay with me to come and see her every day. And I can completely understand your concerns about, her well-being and whether her rights are protected while she is here in the care home, because you can't actually keep a watch on her 24 hours. So, for that reason, I would highly recommend that you join the carer advocate groups. Basically, these are people whose parents are in the nursing home like yours. And these people are actively involved in the administration and management of the care homes. So they can make sure that the patient's rights are protected and they get everything that is, that they are entitled to while they are staying away from their own home. Okay. So you will get to know more about how it functions and how you can be an advocate for your mother as well. Oh, okay. Another thing they do is they occasionally organize informative sessions in terms of whichever disease condition your parents are suffering from. In your mother's case, like it is dementia, so you would get to know more about dementia, how it can possibly progress further, how you can prevent further progression. So this will kind of, you will be well prepared for the future in terms of symptoms and for care. Okay. And finally, these groups could also give you some practical tips, like as I shared some of them with you today. They can also share more tips with you on how you can help her while she's staying in the nursing home. Yeah. How does this all sound? This is quite informative, and I'll make sure to get in touch with this program. Yeah, and in future, if you have any questions or concerns, feel free to talk to me, or you can even talk to our nurse manager. Sure. Okay, we would definitely not get offended because we want to make sure that our patients have the comfortable stay while they are. That's so nice. Thank you. So this is another medicine card where I am talking to the parent of 1 week old boy. This is particularly challenging because the mother naturally would be worried considering that the child is just 1 week old. And if you look at the role play card, majority of the points are about reassurance. So that is the first challenge. Another challenge is in terms of explaining the complicated physiological process of how breastfeeding is connected to jaundice and trying to differentiate between pathological and physiological jaundice because the mother accepts that they have read something online. Okay, so this online information can be sometimes very confusing for them. So, eliciting exactly what they have understood and then trying to clarify things for them, that would be another challenge. So, pay particular attention to how I have tried to explain these things to the parent without using medical jargons and without going into the complicated pathophysiology of jaundice. Okay, keeping it simple yet clear for the parent. Okay. So, good morning, Shivani. Good morning, doctor. So I just assessed Parth and he's doing quite well now. But you seem to be worried. Uh, yeah, actually, you're right. Um, it's just that I don't know how to handle all this. I'm just trying to stay positive, and especially after reading some online information last night, I'm all the way more scared about I see. So it seems that you would like to know more about his condition and you tried to do some online research, but that has confused you further. Yeah, yeah, yeah. Okay. So don't worry. Like as I said, I've just assessed him. He is doing really we were able to diagnose on time. He has received the best possible treatment. So he is safe at the moment and his condition is not as serious as possible. You did a good job, in terms of bringing him to the hospital at the right time. So rest assured. Now, in terms of what is causing these problems to him, right? What do you think, like from your online research, what do you think about his condition? What is your understanding? As I said, I'm all the way more confused now. I don't understand what he has. All I know is some yellow skin color. That's it. Yeah. Okay. So let me explain to you in more detail. Uh, his diagnosis is, as you said, it is jaundice. Okay. And I think what could have confused you is that there are two types of jaundice that happen in the newborn babies. Now, the one jaundice, that is more serious, generally happens within 24 hours after the birth. Whereas in Parth's case, jaundice developed after 4 to 5 days. Like now he's 1 week, right? So, uh, this form of jaundice is less serious. And this happens as a natural response when the child grows up. The bilirubin level is generally very high in the initial few days. But the bilirubin gets eliminated through urine. In Park's case, what happened was that bilirubin was not getting excreted, it was building up in his blood. And that has led to the yellowish, skin and eyes, these symptoms. But it is not as serious as the other form of jaundice that I was discussing. Okay. It is treatable and manageable. I hope this explanation is clear for you. Well, it is, but I still feel responsible for what has happened. And is there anything that I could have done differently to prevent this? I see where this is coming from. Like I assume that this is your first child. Yes. Yeah. And as a parent, you think that maybe it is your fault that has led to this condition. But again, let me assure you that it's not your fault. It is normal part of the process. About 50% of newborn babies get the jaundice. It's that common. Okay, right? It happens mainly because in the beginning, the child is not that used to breastfeeding. Especially in case of mothers who have their first child, they are even not used to breastfeeding. So because of this struggle of taking the breastfeeding and for you like positioning the child, what happens is the child is not able to get enough of breast milk. Okay. And the breast milk actually, helps getting rid of that excess milk. So because of not getting enough breast milk, most of the children develop this condition. I don't see this any of your fault. It's just that because you are new to this, it may be difficult. So, is there anything else that you would like to ask, or if you have any concerns about what just explained? Yeah, as you said, so there is a link between. I mean, I didn't know that there was a link between this feeling and jaundice. So, should I stop breastfeeding now and start bottle feeding? I see. So, yeah, this again is something very common concern amongst the parents, but um, breast milk, as I said, actually helps in this condition. So if you stop breast milk, it is going to do the worse. Right. What is important at the moment is making sure that the breastfeed that you are giving is optimal. It is enough for them. And what we can do to make sure that he gets enough breast milk is maybe I can refer you to your lactation consultant. Have you ever heard about it? No, something like that. It's yeah. So these are the specialists who help the mothers with the correct positioning of the child. They make sure that the child is latching properly. And they would also help you ensure that Parth gets enough breast milk for his growth and for maintaining all the physiological process within his body. Okay. And with the help of them, you can make sure that he is comfortable while breastfeeding. And for the next 6 months, I highly recommend that you should not be giving bottle feed or any other top of food. Say, you should be taking only breast milk, okay, because there are various benefits to be gained from breast milk. Right. Is there anything else that you would like to know? No, I think all my answers are doubts are well answered. So is it fine now? Like, can I take him home now? Yeah, certainly. Like, as per my assessment, his breast milk intake is now enough. Like, it is better than what it was before, and his bilirubin levels have also come down. Slowly, the yellowish appearance would also reduce. So he is fit enough to be discharged home. You can definitely take him home. However, you have to be vigilant about certain things. So the first thing you have to make sure that the yellowish discoloration should gradually fade. If it is deepening or if it is dark, then maybe we are dealing with this solution. You should immediately come back to the hospital. Okay. Right. But another thing you need to pay attention to is any of the new symptoms. Like if he develops fever or if he becomes very sleepy, okay, if he's refusing feeds, then again these are the signs which would indicate deterioration in child's nutrition. Okay. So be vigilant if you notice any of these symptoms. Without any delay, you should come back to the hospital. Okay. Okay. I know this was a lot of information. So what I will do is I'll ask my nurse to give you a brochure which has more, authentic information about journalists. That's a good idea. Feel free to ask if you have any questions. It's like, thank you.